Ladies and gentlemen, it's a great pleasure to welcome you to CIRSE 2021 Summit. We are very happy to welcome you all. We are very lucky to have you with us. We have prepared a great program, and I hope you will enjoy it during these 4 days. Christoph?
Yeah, hello also from my side. Warm welcome to the Summit 2021. It is my pleasure to ask a couple questions to the chair of the program, Professor Thomas Krönke. Thomas, tell us a little bit, what can we expect from this second online CIRSE Summit 2021?
Well, again, it's a very broad program, and we have made some innovations which I think are interesting to most of the audience. I would say there are some things that we can expect, of course. We have the basic courses like workshops, but we have also the expert roundtables, and we have added some new stuff. For example, Meet the PI sessions, which is more on the scientific level. We have again the video learning sessions, which probably you will add a little bit on. So there's really a large portfolio of things we offer here, and I think it will be a great pleasure for all of you to enjoy and take part and be part of this summit. It will be very interactive.
Tell us a little bit about this. I mean, it's an online course, but I think there's a lot of possibilities for our members and participants to actually bring their opinion into the summit and ask questions. Can you tell us a little bit about this? And of course, I think it will be encouraged to do so.
Yeah, you're right. It's absolutely encouraged to take part. We will have, again, the possibilities to submit questions, to be part of the online discussion. It shouldn't be a summit where only the experts talk. Of course, all of you are invited to join us here. And I think the platform is even better now and more facilitating all these requests and interactivity.
Excellent.
Thank you, Thomas. I will ask now Professor Adam Hatzidakis about the program, particularly about the video sessions. Adam, I think you have done a lot in this field.
Yes, thank you, Afshin. We tried this year to combine different techniques with each other, and show our audience how they can perhaps do one technique or the other with one modality guidance or the other one. For example, we have lateral standing with CT guidance or just fluoroscopy, celiac plexus problems, also with 2 different methods, etc., etc. Also thyroid ablation with different techniques like laser or microwave. So we try to have some videos which are more basic for younger radiologists, very educational, I think, and try themselves to choose which is the best and preferable technique for themselves. Then we have more experienced techniques, methods for let's say, more complicated interventions, like coiling of portal shunts, and after tips you can use them for portal hypertension, and more sophisticated techniques also for aneurysm thrombosis, and very interesting cases in any case. So I think that all levels of interventional radiologists will find interest in these videos, and I hope that they will enjoy it.
Another question, Adam. What have you done for the students and the young IRs in the program?
We have a special interest for them, of course, and we tried to have more basic lectures for them. Some of them are in workshops, some others are in special sessions for the junior forum, and we are very happy that also a lot of medical students are participating with a special way without fee, for example, and we are looking forward for their participation because we, of course, believe that they are the future for our society.
I want to thank Thomas and Adam for the hard work you have done. We are really looking forward to this program, and we count on you to participate actively, ask your questions, participate in every session you can. I think this is the opportunity to be together, even if it's online. Thank you very much. We are looking forward to have you with us.
Another highlight of this year's CIRSE program is the PAD Day. And I'm going to introduce to you Professor Fabrizio Finelli and Professor Stefan Müller-Hulsbeck, who have created the program. So Fabrizio, what is the CIRSE PAD Day?
So the PAD Day is a session completely dedicated for peripheral arterial disease. We believe that this topic is of great importance for interventional radiology. We know that every day we have to discuss with other specialty that are looking for our area or our patients, but I believe that with PAD we can improve the effort through our colleagues.
Thank you. And could you just run through the basic structure of the day, please?
The PAD has multiple different types of sessions. We have key opinion leaders working and discussing and debating different topics dedicated for the peripheral arterial disease. We have a round table. We have some debating about different topics. And at the top of that, there is also the first at CIRSE. That is the most important session, in my opinion, where new data will be presented for the first time to the audience.
Thank you. Stefan, would you like to tell the audience of any highlights that you see in the program?
I would say the PAD Day itself, it's a highlight, and every session which was already introduced by Fabrizio is a highlight itself. But my personal highlight is always the daughter lecture, and this is completed definitely by the latest information we receive on scientific research, which is also published simultaneously in CVIR, our journal. It's the first at CIRSE Day. The first at CIRSE, I think it's really it's outstanding.
Excellent. Fabrizio, are there any other highlights you would like to highlight?
Definitely the debate about the drug-eluting technology is something is one of my favorites, especially because nowadays we are looking to new drugs, and maybe this could be a window for the future for IR procedures.
Okay, great. Well, a great day in store. Over to you, Afshin. Thank you.
We are lucky to have Professor Scheller from Hamburg for the Prize of Innovation and Excellence. Unfortunately, Professor Speck is not with us, and I'm giving the occasion to Thomas to interview him.
Yeah, it's my great pleasure, Professor Scheller. This is really a great day. We are honoring you for your work in interventional techniques, and you are really, together with Professor Speck, one of the pioneers of drug-eluting technology. And maybe for the audience, could you give a little bit of insight how you came up initially with the idea of drug-eluting device technology? What was the way you connected to Professor Speck, and how did this really went into what it is today, one of the most important innovations in interventions?
Yeah, thank you very much. First, I want to say thank you to all of you. Thank you also on behalf of Professor Speck to have this award this year. It's a really great honor for us. The project for local drug delivery started more than 20 years ago. I was in the late 90s, young physician in training for internal medicine and cardiology. And I was lucky to be allowed to go to the cath lab very early. And so I started to do some research work as a young doctor. And I looked at the impact of different contrast media on complications after coronary interventions. And we published some papers out of this. And in one of these papers, the results for the iopromide, the contrast medium of sharing, was not that good. And Professor Speck was at this time head of R&D contrast media at Schering. He developed iopramide. He was also team leader for the development of gadolinium in earlier times. And so they were not amused about my publication, and they invited me to Berlin to discuss about these results. And the meeting was okay. They were very gentle to me. And Professor Speck was at this time already looking for new applications for contrast media. He was not satisfied that there were no new developments in this area. And a few weeks ago, I was for the first time of my life in 1999 at a TCT meeting in Washington, and I attended a session with preclinical data for local drug delivery. And they presented the first data for drug-eluting stents coated with paclitaxel and so on. And under this impression, we talked about possibilities to improve contrast media. And so the idea was born to mix contrast medium with antiproliferative agents. And we did some first ex vivo experiments, and interestingly, it was the case that the contrast medium was an excellent solvent for paclitaxel and its analogs. And so we did the first animal trial in the porcine stent model. We implanted bare metal stents and injected either pure paclitaxel or pure contrast medium or paclitaxel in a combination with the contrast medium. And interestingly, we found a dose-dependent reduction of neointimal formation at 4 weeks in this animal model. This was totally surprising. And then we repeated the experiment and we could confirm these initial results. And so we had the first proof that contact time of few seconds by the injection of the contrast medium leads to a longer term biological effect. The problem was, of course, that you can't really control where the drug goes if you inject it via the contrast medium. And so the idea was born to have more lesion-specific solution. And at this time, in the year 2000, we had all the preclinical data already on file for the drug-eluting stents. So we knew that very long-lasting release is efficacious in reduction of neointimal formation of restenosis. And from our own experiments, we knew that few seconds have also an effect. So we were looking for something in between, and this was, of course, the balloon, to coat the balloon. So that was the way the idea was born.
Well, your seminal work to that really led to a broad acceptation of this technique. And do you recall the comments in the beginning? Did people trust into that? Did people buy into that idea, or did you have problems to publish? Actually, I think this is of interest also to all members of the society. Maybe you could comment on this.
So the first reaction was, this will never work. After we had the animal data, people said, okay, if this really works in animals, forget it, it will never work in humans. And after we had the first results of the clinical trials from the coronary PACCAT trial and from the standard trial and FEMPAC trial, then people said, okay, it may work in humans, but nobody needs it because we have drug-eluting stents. And in a similar way, it was difficult to get funding for further research at this time. This was extremely difficult, and we had several times very short before the decision to stop the whole program because we had no money anymore for further research. And most of the medical journals also rejected it because they didn't believe it, or as I said, there's not enough high priority. But this was not always the case. We had, with the contrast medium, we had the European Heart Journal with a Czech who accepted it, and later for the clinical trial, it was then the New England Journal, and then it was fine. Then people believed also in the results we had.
You followed this idea very consequently. Did you have a big team behind you, or was it in the beginning just you and Professor Speck, or how did this evolve?
So the in the beginning, we both had the idea, but he was at this time at the Charité, at the Lab of Experimental Radiology, headed by Professor Bernd Hamm. And I had also lab capacity at university from our groups. And so there was a lot of support by the normal work from the universities. And there was also the Charité who supported us with the first patent applications, because this was extremely important part of this whole development. So this was really the support of the universities that helped us in the first years. And these were all the groups that were connected to us at this time, of course.
So looking now a little bit more into the future, I mean, this technology is now on the market, it's available, there are gradual modifications, so to speak. From here on, in let's say 15 years, do you think we are using the same technique? What is your outlook on the future here?
It's of course very, very hard to predict. What I can say, we have several key areas where we can improve the technology. Number one is drug loss in blood, which is still an issue of many of the technologies. There's also room to improve the transfer rate to the vessel wall. The question is, will paclitaxel remain the gold standard, or will there be other drugs even effective or more effective? That's an unanswered question at this time. Especially in the coronary arteries, we have to find solutions how to deal with dissections, because at the moment the alternative is, if you have a dissection, it's a permanent implant, of course. This is also the case in the peripheral arteries, but not that amount. So there's a lot of room for improvements, especially in the field of how to avoid dissections or how to control dissections.
Thank you, Professor Scheller, and also extend our congratulations to Professor Speck. It was a great pleasure to talk to you here, and I hope that we see each other at one occasion in the next years, maybe next time in Barcelona. And thank you for attending here.
Thank you. Congratulations.
Thank you very much again.
Thank you.
Thank you, Afshin. That was very interesting. And thank you also, Professor Scheller. I have with me now Dr. Alex Barnacle from Great Ormond Street, London, who's been involved in the creation of the Pediatric IR and Women in IR sessions. And so, Alex, would you like to tell us about the Pediatric IR sessions, please?
Yeah, I'd love to. It's fantastic to see so much Pediatric IR in the program this year. It's something that CIRSE's really been investing in the last few years in particular. And we've seen it grown again this year. So there are multiple Pediatric IR sessions, live and on demand, where they're really, truly international faculty of experts from around the world. One of the benefits of being online is that we can access a greater breadth of faculty, I think. So there are some basic sessions for people who are really just starting out with Pediatric IR. But also some pretty expert sessions in there too, looking at how we can nuance some of the more complex IR techniques for children, how we can keep our IR suite optimized to keep the dose down and the children safe, especially very small children, how we can work better as a team with our anaesthetists and other specialties, with everything from vascular malformations to venous intervention and hepatobiliary intervention as well. So yeah, it's looking good.
That's excellent. And the Women in IR session?
Yeah, that's another superb session that I look forward to every year, and it's great to see it on the program again. This year we're focusing on flexible working, which is something that I think is very close to many women who work in IR, but is certainly not unique to IR, and I hope that everybody will find something in this for them. I think it's dealing with the challenges of flexible working is something that many women have always struggled with in a busy career, who have also got the challenges of a young family, but other commitments as well, such as research or other things that you may want to flex into your career. But I think the pandemic has made that even more important to us now, and I think a lot of us are thinking about how we could reshape our careers perhaps to give us a better work-life balance. So we're going to look at how you could flex your career a little bit to give you more of what you want and to feel that you're delivering everything still in an expert way. We're looking at how you could nuance your whole department's job plan to make that possible for the people who need it. And then Jerry O'Sullivan is also coming to talk to us about returning to work. So I think that's one of the things that may put people off taking some time out, is what's it like coming back, especially to a specialty like IR, which is very hands-on and practical, and where you may worry that you've lost your skills. And he's got some great insights on that for us as well. So I think it'll be a great session.
Excellent, thank you. So over to you, Afshin.
Thank you, Rob. Thank you, Alex. We are lucky to have Professor Hamadi with us, who has organized the 2 days of ideas, Monday and Tuesday. Can you tell us more about the program, please?
Thank you, Afshin. It's another exciting time of the year where Cersei and ideas coming live. This year's program is quite comprehensive, covering a wide range of topics in aortic pathology and interventions, from the aortic valve to the groin. We have over 18 sessions and around 70 talks, which cover the most challenging and the most interesting topics that people interested in this field will be listening to.
Great.
This sounds great. I'm looking very much forward to ideas again. Can you let us know a little bit about the different formats of the sessions of the Ideas Congress?
So we have two lines of broadcasting, the on-demand sessions and the live sessions. In the live sessions will have a case-based discussion where experts will be exchanging ideas and discussing things about the stroke prevention in TIVAR and challenges in the infrarenal rupture aneurysms, and also in the infrarenal repair, the challenges facing the service delivery and training, and also providing the best care for the patients. We have also amazing sessions, which the first time features in aortic intervention in this meeting. We have video recorded cases, and we have also 2 workshops that deal with the planning of EVAR and selecting the best patients and the best equipments. And also another important workshop, which is dealing with radiation protection during complex aortic intervention, which is, I'm sure, will be of a great interest to all listeners and workers in this field. And also we have the industry contribution to the scientific program. We're grateful for them for that. We have 2 symposium, one talking about the latest advances in the thoracic stent grafts and the lessons learned so far, and the second one about the developing evidence in bridging stents, which is an important question in the field, remains an important question.
Great. Mo, which are your personal best?
Well, I mean, that's the most difficult question. I wasn't expecting this one, because it's if I say anything, I wouldn't do justice to the program. It's actually quite a comprehensive program, and I would try to listen to everything in it. But the things like, I will give you a snapshot. The TIVAR, the stroke prevention in TIVAR, this is a very important one, and we know that the incidence is quite high, and we need to do a lot about it. Also, there is the amazing aortic intervention. I'm looking at it. And also another one, which is the always popular session, the worst day in intervention. We all learn a lot from it. So many things. And I really encourage the audience to visit the website and have a good overlook over the overview of the program.
Thank you so much, Mo. We are really looking forward for these 2 days of ideas. I'm now handling directly to Professor Klaus Hausegger, the editor-in-chief of CVIR. Klaus?
Okay, so it's a great pleasure for me to introduce to you Dr. Cornane, who is the winner of the Editors Medal this year. It's a really pleasure to meet you and to see you live now, Dr. Cornane. And it's a pleasure for me to donate this medal to you for several reasons. The first reason is that this study, which is the 10 years result on the body trial, addressed a very important topic, which is the mortality, the possible late mortality for drug-eluting devices. And you will tell you something about that. And the other thing is that this was an investigator-initiated trial, which is not often the case anymore. It's where we know that in these times it's very difficult to perform trials without strong support from industry. And I think this is really outstanding that the team of Hans Oberhagen and you could perform this trial over such a long period. So can you tell us first something about the main outcomes of this study? And then we have to, okay, please go ahead, yeah.
Oh, no, of course. Yes, I will tell something about the main outcomes of the study. Of course, as you told us, this was an initiated study, investigator-initiated study from the Haga Hospital by Hans van Oberhagen with the support from Utrecht University. And the study's main results is that the PADI study showed that the drug-eluting stents, the paclitic cell drug-eluting stents below the knee in CTLI patients are better than the reference treatment with BMS PTA on short and midterm results. And with this study, we now have shown that in the 10 years analysis, this is also shows a comparative survival to PTA and BMS. That's the first great outcome of our study. And the second is that we have shown that there are no adverse effects on dose-related mortality or dose-weighted related mortality in terms of body weight. So those are the two main outcomes of our study.
Okay, so, but there's one thing which I do want to address critically.
Yes.
And this is that when you look at your 10 years result, the mortality rate, unfortunately, is extremely high in both groups, in the drug-eluting group and in the bare metal group. It's near to 80%. So how would you comment this data?
Yes, of course, we know that the outcomes in CLI patients are extremely poor in our study, but also in comparable studies. And indeed, almost all patients had died after 10 years. But the results are both in the DES group and the PTA-BMS group. So we did not have any significant p-values for that. So yes, it's true that CLI has a very poor survival. And that's something what we should treat maybe more aggressively if we can find the opportunities to do so.
Okay. But you, and you already addressed this, you found higher patency rates and lower amputation rates in the group where you used the drug-eluting device. At least, as far as I remember, in the 5-year results, you had lower amputation rates and higher event-free rates in the drug-eluting group.
Yes.
So, do you have any impression about the quality of life of these patients?
The quality of life of these patients, when we compare those two groups, if that's what you mean, the patients' categories were completely similar. And of course, the quality of life will be better with the drug-eluting stents when they can prolong their walking and their mobility. But of course, it is a severe affected group, our CLI patient group, and they have, of course, more than one disease. About 70% of these patients are diabetics. They had stroke in 20%. They had coronary arteries in 40% almost. So they are a heavily, severely affected group, as to say.
So what do you think, where should our future perspectives go? So when we look at it, we can achieve reasonable recanalization rates, but still the whole disease is the limiting factor for the patients. So will it be going more to medical treatment? Maybe you know you heard the results of the Voyager trial, where it could be shown, it was shown that additional medication will improve event-free survival.
Yes, yes, of course. When the first treatment strategies and guidelines were released in the early years, there was more most of the studies were how do you say, treating the lesions in the leg, and afterwards the guidelines were more to best medication results. Yeah, so we also think that that's one of the options to improve those patients' lifetime more. And what we think the interesting point is that what we see is that with those trials, there are still very high rates of coronary artery disease and also strokes. And those are the two main points those patients die from. So we hope that we might treat those patients more aggressively for those kind of therapy, for those kind of diseases, because that's where those people are dying from, not from the peripheral arterial disease in itself. If you understand.
The bottom line is not only to look at the limbs of the patient, but to the whole patient. And as you correctly pointed out, it's also about coronary disease and cerebrovascular disease. But as far as I know, you're not only researching on these crural arteries and drug-eluting devices. You have done some studies on arterial calcification. And I read several publications from you. Can you tell us something about that?
Yeah, so the initial PADI trial of Marlon Sprain and Dr. Hans van Overhagen, of course, they found that patients with a very high or immeasurable high ABI had a very poor survival. And afterwards, I did one of those studies to see if calcifications had probably some effect on that. And what we found is that patients with complete circular or annular calcifications, they had an even more poor survival than the already poor survival CLI patient group. So that is what we found, and it's an interesting finding. We also are looking at the systemic calcification rates. I'm currently writing one of those studies. And what we see is that those patients with TLI or CLI, how you call them, are heavily, extremely calcified. So that's one of the study results of those studies. And it's interesting to look more to those calcifications because it's it may not be only the atherosclerotic pathway, but maybe also another disease, what's also at stake in CLI.
Yeah. So if you take those two trial results together, meaning this calcification and the results about peripheral balloons below stents below the knees, how would that help us in our daily work for decision making? How to treat our patients?
How to treat the patients? I think, as far as we know, I'm in diagnostics, and maybe for the diagnostics options, we can try to find those patients with the most circular calcifications at first, to see if they are more prone to have the strokes or coronary arterial disease, or maybe screen them for that. That would be one of the options to prevent more aggressive disease in systemic calcification or systemic arterial disease. Mm-hmm. Yes.
Okay. And what are your further projects?
Those projects are, as we discussed a second ago, is one of the projects. And because of the CIRSE Editor's Medal, I can, next to my radiology residency, have 1 month or 2 months full-time to fulfill my PhD thesis. So I'm very grateful to CIRSE to be able to do that. And yes, we need to see what other research lines can do for those patients group. We're still digging into that subject to improve the survival of CLI patients. Yes.
And may I ask what the topic of your thesis will be?
The thesis will be arterial calcifications and the prognosis, but also the outcomes, as we discussed a second ago. Yes.
Okay. So we are looking for further results from your study group, and thank you for your explanation of the study. And congratulations once more to you and, of course, to the whole study group. Thank you very much.
Thank you, and thank you again for the reward and the medal and everything from me and my whole study group. Thank you.
Thank you.
Congratulations. Thank you, Klaus. Now we are very happy to present the honors, not only from this year, but we will begin with the honors of 2021, who is our friends and colleagues, Elias Brunsos.
It is a great pleasure to give the laudation for Professor Elias Brunsos on the occasion of his CIRSE Gold Medal. Elias was born in 1956 in Piraeus, a port city of Athens. He is a true son of Athens. Not only was he born and educated there, lives and works there, but I hope it's not just me, but I think there is more than a passing resemblance to the busts of ancient Athenians, as you can see here. Elias is currently Professor of Interventional Radiology and Head of the IR Division at the National and Kapodistrian University of Athens, NKUA for short. He graduated there in 1981 with high honours and then went on to perform a PhD in 1986, also with high honours. He undertook a surgical residency in Patras Medical School University from 1983 to 1988. And it is here that he first came across interventional radiology and became enthralled and was determined to become an interventional radiologist. He practiced radiology at the Metaxa Cancer Hospital in Piraeus from 1990 to 1999 and performed all the interventional radiological procedures on the oncology patients. In 1992, he was a research fellow at the Massachusetts General Hospital. And in 2000, he became assistant professor of IR at NKUA. And in 2002, was given a grant from the Greek Radiology Society to attend the Dotter Interventional Institute in Oregon as a visiting research professor. He was made a full professor of IR at NKUA in 2012. Elias's research interests are mostly in the vascular and oncology field. Here you can see him on the left at a CIRSE roundtable talking about carotid interventions, and other interests are TIPS, and then more recently radiation protection, and you can see him here at the radiation protection stand at CIRSE. He has co-authored 165 scientific articles, and he is a member of the editorial board of CVIR, but also reviews for many other medical and radiological journals. Elias, the professional man, has been a member of many CIRSE committees between 2004 and 2012. He was chairman of the Scientific Program Committee from 2010 to 2012 and was chairman of the local host committee of the Athens Annual Congress of CIRSE in 2007. He is a member of the CIRSE Radiation Committee, and in 2012 he was elected treasurer of CIRSE, followed by vice president of CIRSE, culminating in his presidency in 2016 to 2018. He is a member of many Greek radiological societies, and in 2020 was the president of the Greek Society for Interventional Radiology and Neuroradiology. But there is more to Elias than work and medicine. He is an action man. He undertakes many sports. Here you can see him cycling, mountaineering, and skiing, and actually often combines all three. But he could do none of this without his family. And here you see Elias, the proud family man, with his lovely wife, Rina, and his two gorgeous daughters, Eva and Irene, who will keep him on his toes, but support him in all his endeavors. Elias is a dear personal friend. I first met him in CIRSE when we were performing workshops together in the early 1990s, and we've collaborated on many projects since then. Despite his prodigious academic prowess, he is actually a very humble man. And in contrast to his rather bold sporting activities, he is actually a gentleman. He is a great inspiration to all those who know and work with him, and he is truly the deserving recipient of the CIRSE Gold Medal. Dear Elias, congratulations.
Congratulations, Elias, and thank you, Ana Maria. The gold medalist of 2021 is Julio Palmas, and he will be presented by Professor Johannes Lammer.
Ladies and gentlemen, dear Julio, it's a great pleasure and honor indeed to give the laudation for Professor Julio Palmas, a great inventor in interventional radiology and vascular medicine. Professor Palmas, he was born in La Plata, Argentina, and he also made his medical degree in La Plata. And then he moved with his family to the United States, California, where he stayed for 6 years. And finally, he moved to San Antonio, Texas. The reason to go there was that there were ideal experimental facilities, and he was very interested in experimental work. There, he was working on the development of an endovascular implant, a stent. And so he developed the balloon expandable Palmas stent. He firstly presented his experimental work with his balloon expandable stainless steel stent at the RSNA in 1984. I remember this very well because I was at the same session and presented my endovascular laser work, which by the way was not very successful and was terminated a few years later. But his invention, of course, was a tremendous success. The funny thing it was a very small session where only probably the 5-6 presenters were at the sessions, and therefore when he first presented his work, almost nobody could hear it and hear what great invention has been done. He finally patented the balloon expandable stainless steel stent in 1985 and sold it to Johnson & Johnson. The first implant in man was done in Freiburg, Germany, together with Götz Richter, and the first publication of the implantation in man was done 1988 in radiology. Professor Julio Palmas also knew the potential of his balloon expandable stent for other applications. Together with Dr. Schatz, a cardiologist, he also developed a coronary stent, which is an angulated stent. And this was also very important because recoil and rethrombosis after balloon angioplasty in the coronary arteries was a very dangerous complication, and therefore the stent was very important to improve the result of coronary angioplasty. He created the tips, so the stent shunt, and this stent shunt is nowadays the therapy, the first-line therapy for patients with ascites and for patients with esophageal variceal hemorrhage. And together with the Argentinian vascular surgeon Juan Parodi, he did the first implant in a patient with an abdominal aortic aneurysm. He was introduced in the National Hall of Fame, and his invention of the balloon expandable stainless steel stent was recognized as one of the 10 most important inventions of the last century. He now runs a vineyard in Napa Valley in California, together with his family, his wife Amalia, and his 2 children. They produce excellent Cabernet Sauvignon and Riesling wines. Once when I visited him in California, I had the opportunity to taste them, and they're really exceptional. Professor Julio Palmas is always looking for something new. Whether these are new stents, whether these are new applications such as tips and endovascular treatment of abdominal aortic aneurysm, or whether this is development of excellent wines in Napa Valley. Dear Julio, it's now a great pleasure to present you the gold medal of CIRSE for 2021. We are very proud to have you as a gold medalist in CIRSE.
Congratulations, Professor Palmas, and thank you very much, Johannes.
Thank you, Afshin. It's now my pleasure to announce the distinguished fellows from the years 2020 and 2021. We have Tony Kreiner, Sanjeev Sharma, Brian Stankin, and posthum Joseph Take. The distinguished fellows from 2021 are Steve Haskell, Thomas Hellenberger, and Werner Jaschke. Congratulations to all of them. It's a big achievement, and they were very loyal and helpful for the society, and I hope to see you soon in person at the next CIRSE meeting. Thank you.
Unfortunately, last week we lost one of our distinguished fellows, Professor Dimitris Kelekis, and we would like to express to his family our deepest sympathy and condolences.
Now I'm inviting everyone to join the Summit 2021 of CIRSE. Enjoy the meeting, participate actively to every sessions, and make it live. Thank you. And now I'm inviting everyone to join on stage and to open the summit. Thank you. Hey.
Wonderful.
Wonderful. Thank you.
Thank you very much.
Magnificent.
All right.
Thank you
Grab
so
a
much.
glass. Grab a glass.
Adam.
Thank you.
Adam.
Thank you so much.
You.
Thank you.
To CIRSE and the Summit.
Cheers.
To CIRSE and the
Cheers.
Summit.
Cheers. 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 Cheers.